Okay, so we are in the last module for the entire summer session. This is module 13. So this is the third one of 3 that you have had for this week. And in this module, we're covering chapter 13, psychological therapies. So as I said in the last module, you've got a good overview of all the various classifications of mental illness. And now we'll be diving into how to treat each of those. So here is the to-do list. Let's take a look at the objectives for the chapter. Again, you're going to want to be kind of flipping back and forth between chapters 12 and 13 to sort of jog your memory of what each disorder is. If you have your lecture slide notes actually next to you while you're reading this chapter, that's going to be really helpful. The lecture slides from chapter 12 and 13 will be helpful to have on hand. We'll be taking a look, just like we did in the last chapter, first at a historical perspective of mental illness. How have psychological disorders been treated in the past? How far have we come in terms of treatment? And then what do we do today to classify and treat those with mental illness? We'll be looking at some different perspectives on that. So just like we did in the last chapter, we looked at cognitive perspective, social cognitive perspective, behavioral, and biological. We'll be doing sort of the same idea in this chapter, but this is with therapy. So there's different approaches that psychologists or psychiatrists can take in treating someone with mental illness, and they're not all the same, and some people actually benefit from using a number of different types of therapies and kind of finding what works for them. And a lot of times people will cycle through various therapists, so they might go through 1, 2, 3, however many therapists needed until they find their fit with somebody that really understands them and starts to make some headway with the therapy that they're using. So the very first type that we'll be taking a look at is psychoanalysis, and that comes from Freud. It is more currently referred to as the psychodynamic perspective or approach to treating mental illness. And you'll want to be looking at the various aspects of that, which are detailed here. It gets a little bit into defense mechanisms, which we looked at when we discussed the personality chapter. So we'll be revisiting a little bit of that here as well. Then it moves into humanistic therapy, which is also known as person-centered therapy, and this comes from the Gestalt approach. And it's very much using the work of Maslow and Rogers, who we covered in the personality chapter. So we'll be taking a look at, how do they think that mental illness is best approached and treated, and what would be the types of therapy that they would use. We'll then revisit some of the learning perspectives, classical and operant conditioning, and evaluate those techniques on disordered behavior, used mostly with anxiety disorders, and that overall kind of anxiety umbrella. OCD falls under there. Any stress-related trauma illness would fall under there, and how we would use those learning principles to perhaps recondition a person into sort of quote-unquote normal through maybe a stress-related trauma, or they have an anxiety to something, a social phobia, or any other kind of phobia that might be preventing them from carrying out normal day-to-day activities. These can be very helpful techniques that are very easy to employ and easy for the individual to keep up with and do on their own. And then we will move into the elements of cognitive therapy. So here is where the idea is change the thinking and change the behavior that follows. So it's using those different cognitive approaches that the person can employ on their own once they learn how to get themselves out of maybe a bad situation where their thinking starts to get the best of them. We talked about learned helplessness. We talked about the various types of anxiety disorders. And much of that, there's a cognitive element. It's oftentimes the thinking that gets just out of control, and the person feels out of control, like they can't stop it. So the idea here is to kind of regain control over those thought processes and learn some techniques that help to do that. Okay, after that, we move into talking about group therapy. And there's definitely some advantages and disadvantages to doing therapy in groups. Commonly, we think of group therapy as being like marriage or family therapy, but it can be much more than that. Group therapy can be very effective when you get a lot of people who are dealing with the same mental illness and they're hearing one another. There's some solidarity in that, there's some understanding in that. And so it can be very effective for some people. Others need the more one-on-one. So it'll cover some advantages and disadvantages of that. Then we'll be moving into psychotherapy, touching very quickly on cybertherapy and what that is, and just overall what's the influence and effectiveness of therapy. So from individual to individual, what can we expect the outcomes to be? With a given disorder, how many people get better, and what do we mean by better? How do we define that? And it's different for each classification of disorder. And then we'll move into some of the more biological treatments. So really the end of the chapter deals with the biological approach to psychological disorder. So it gets into a lot of talks about drugs, what drugs are used to treat which disorders. There's much overlap. And as we've already discussed in earlier parts of this chapter and the last chapter, oftentimes people have a variety of symptoms. So someone might not just have anxiety, but they might also have depression. They might have a personality disorder. They might also have an anxiety disorder. So a lot of times these mental illnesses can be comorbid. And so it gets tricky to diagnose and it gets tricky to treat in terms of drugs. Different drugs have interactions with one another, and that can be a very delicate balance for the patient and the provider to maintain an effective course of treatment and one that's going to allow the person to have as normal a life as possible and quality of life in that. So we'll be looking at what works best for, and this is all generally speaking. There's obviously a lot of individual difference, but we go off of sort of statistics and numbers of the majority of people. How do they do on said drug? And keep in mind too that a lot of times people are taking biological types of treatments, drugs, and such, as well as therapy. So they're in therapy, they're in counseling at the same time, and actually the most effective treatment for any psychological disorder is the combination of therapy and biological treatment. And then the very last part, we'll be looking at some more drastic treatments for psychological disorders, specifically the more severe schizophrenia. We talk about electroconvulsive therapy and psychosurgery, which are typically like last resort types of treatment when the patient has been through a number of different drug therapies and nothing is working. There's some relief found with these different types of treatments, but they are more drastic, and so caution is always used when we're talking about this. These are not things that people would jump right into. Okay, and then very last off, we'll take a little bit of a look at virtual reality for treating psychological disorders, specifically some trauma-related stress disorders, anxiety disorders like PTSD. There's some very promising work in the world of virtual reality for treating and working through those types of illnesses. Okay, once you've finished that, you've got your lecture slides. The videos that you're watching this week are coming from episode 17. So if you recall, in the last module, you were also in episode 17, but now you're going to be looking at videos 3 through 5, which deal with the therapy side, assessing treatment, all the way through how does someone go about finding a therapist and finding the right fit with a therapist. Your discussion for the week is on the Hawk reading number 34, and it deals with anxiety and phobia disorders, related disorders, and how we can actually condition ourselves out of those. So it's called Relaxing Your Fears Away, and it's based on the principles of learning, specifically classical conditioning and operant conditioning, and how those have been very successfully used in treating people with all types of phobias. So for the discussion, you're going to be taking a look at how someone acquires a phobia via the learning principles, going back to those basics of classical conditioning. What are the stimuli that are present, what elements have to be present for someone to be conditioned to fear something, for example, and how would we reverse that process in the use of treating a phobia. So you're going to be discussing that. And just keep in mind, again, that the due dates are different. I mentioned this in the last module, but the due dates are going to be, your original response is due Wednesday, June 27th, and your responses to other people are due Thursday, June 28th. So again, that's the divergence from the previous 5 weeks that we've had. It's a little bit truncated, so you want to be paying attention to those dates and not miss turning anything in. Once you've finished through your discussion, quiz number 13, your very last quiz on the chapter 13, is due by Wednesday. And once you've finished that, you have your test. And this test is covering 3 chapters. It's covering the cognition chapter, the psychological disorders chapter, and the treatment of psychological disorders chapter. So 3 chapters. You've got 45 minutes to complete it, 45 questions. It is just like the rest of the chapters. It's just a little bit longer because it's covering 3 chapters instead of 2. So you have 45 minutes to complete that. And that is the end of the modules and the end of summer session. It's been really great getting to know all of you. I've really enjoyed your discussions. You've been a really great class. I'm really hoping to get some feedback. So please feel free to email me. Let me know, what you thought about the class. You'll all have an opportunity to evaluate the class. Once we've finished, you'll get a link to do that. But I definitely appreciate any feedback you have about, what you liked, what you might want to see improved. I love to hear that because I definitely use that in the future when I'm preparing my classes. So with all that said, please feel free to let me know if you have any questions as you're working through this material this week. And I'll do my best to respond promptly if you have any issues. Again, too, if anything goes wrong with dates or getting in or getting access to material, please let me know right away so that I can fix that. Okay, everyone, have a wonderful rest of your summer, and thank you so much for being a part of this class.